Pleased to welcome back Charlene Orne and Deb Czuchra, who have been here before for another informative dive into our well-being. They're both integrative practitioners with more than 5 decades of combined experience in both conventional and integrative care. They're trained through the School of Applied Functional Medicine and specialize in helping adults understand digestive, hormonal, metabolic, and stress-related patterns that underlie persistent symptoms, and help people understand how their bodies function and guide them as they move forward with greater confidence in their health. So thank you for being here.
Thank you. We're happy to be back.
To learn.
Are we going to keep the doors open?
We can totally close
well, I
them.
didn't know. I'm not going to yell or anything, but I don't, it's a library.
Yeah.
Should we leave them open?
No, you know me, I get loud.
Yeah, she's louder than I am. We should shut them. So welcome everybody. Thanks for coming in. My name's Charlene. This is Deb. And hi everybody on Zoom. Thank you for joining us. Tonight, our title for our talk is why digestive symptoms don't start in the gut. So if that seems a little confusing, we're going to get into why, and hopefully by the end of the talk, you'll say, ding, ding, now I get it. Now I get it. So here we go. I don't have a mouse. Bear with me. I'm used to right-handing. So let me just read this disclaimer and get this housekeeping out of the way. This talk is intended for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. The content shared reflects the presenter's professional expertise and research, but is not substitute for consulting with a qualified healthcare provider. Always seek the advice of your physician or other licensed healthcare professional with any questions regarding a medical condition or treatment. So tonight's conversation is about understanding digestion in a clear, practical way. What Deb and I do as functional medicine providers in our practice is when we think about digestive symptoms, we think about why the symptoms are showing up together. And tonight we're going to talk about that, how digestion actually works. So we're going to shift backwards into the old, but yep, that's a good question.
Yeah.
No, oh my God, so cute.
Good point.
Go back a little bit and talk about the actual anatomy, physiology of the digestive tract, what influences digestion beyond food, and how we make sense of digestive symptoms when we see clients. Quick question before we begin is, what, if you're willing to share, what brought you here tonight regarding the topic of digestion, or maybe symptoms, or understanding what you can improve? Anyone want to share? Anyone on Zoom?
You could type it and I can read it out loud.
A lot of clients will come to us with generalized symptoms, fatigue, maybe they want to lose some weight, some hormones. Oh,
someone says excessive bloating.
Oh.
Someone else said H. pylori 3 times.
Yep, that can be recurrent often. Bloating is probably the #1 digestive symptom that our clients complain of. Very common, very common.
Understand some digestive distress I've been experiencing, which is contributing to sleep struggles.
Yes.
Someone else said aging.
And we'll talk about all those things, but because they all have something to do with our digestion. And did you have something you wanted to say?
Yeah, what drew my interest is that the title is not coming from the gut.
Yeah.
Because all what you hear these days,
right,
it's gut health, gut health, gut health, gut health. So that's why I'm like, I like to see the opposite.
Right. So we got you. That's how we got you in here.
Yeah.
Success. All right, great. Thank you for sharing, everybody. So this is Deb and I. We have decades of experience in traditional care. And tonight we're really just, shifting the focus from disease to root cause, because that's what we do now. We're functionally medicine certified. And what we noticed in our many years doing conventional medicine care is that there are a lot of symptoms. Because we're all women, I can say this. Sorry, but this happens to men too. But is that people come in and they have symptoms, but they're unable to put those symptoms in the conventional medicine box for a diagnosis. So we have learned all these protocols for XYZ symptoms, but this person doesn't really meet everything that leads these symptoms in this particular diagnosis. Or, well, they have some of these and some of these, so I don't really know what it is, but let's try this medication. Or so because of that, being functionally medicine trained, there are different ways to look at healing the gut and dealing with those digestive symptoms. And that's what we're going to talk about tonight. So our clinical lens is a whole body view. So on this slide are all of the things that we look at. Of course, we look at the digestive tract, between here and here, or I should say here and here. We look at the nervous system, hormones, liver and bile flow, and the immune balance. So we kind of pull that lens back and incorporate the whole body, and not just the actual digestive tract. So our framework of making sense of digested symptoms, and let's use the example of bloating. Somebody comes to us and says, I'm just bloated every afternoon. I start out in the morning, I can button my pants, and in the afternoon, I'm unbuttoning my pants. I'm uncomfortable. So what do we do with that? We look at how food is being broken down, how digestion moves, how is your system doing its job? Our bodies are very smart. They take over. As soon as that food goes down, our bodies take over and we can't do anything about it, right? It's just a big, long track and it has a big job to do. How stress influences regulation of your gut health, how your body clears waste, and that's motility. Are you hypermodal when you have diarrhea, or are you slow and you have more days of constipation? What are driving these symptoms? And like I said, these are the ways that we look at when somebody comes in with any type of digestive symptom. Okay, here we go. Here's your anatomy for the night. That is the digestive tract. Now, when we look at this, the main 25-foot long system, it's a coordinated pathway, not a single organ. There is a lot that affects digestion. So when we eat something, the food is broken down so nutrients can be absorbed. I think we all kind of know that. Movement and elimination are essential. And everything needs to work together from top to bottom. And I think what people don't think of is when you see food and when you smell food, your brain is already starting the digestive process. Your salivary glands start working, right? You kind of get moist in your mouth and you're about ready to take that bite. The only thing, and this is super important, you'll probably hear it a couple times tonight, is the only thing we can control with digestion is chewing. So that's a big job. And if you want to help your digestion, chew your food. Not twice, but like 25 to 30 times. Chew and chew and chew. And when you think you're done chewing, chew some more. Like it's just because you are helping. There's enzymes breaking it down. You're chewing, you're making it smaller. You're going to have less problems down the way. If you chew something twice and swallow it, and then you inhale another bite and you're eating really fast, the rest of the system is going to have a hard time and it's going to cause problems. Sometimes just slowing down and chewing solves a lot. It's kind of amazing. So, why the gut is central to health. So the gut connects with immunity, the brain, and your metabolism. It determines how well we absorb nutrients because we swallow food. It has nutrients that needs to be broken down and the body needs to absorb it. The body's in constant communication with the immune system. 80% of our immune system actually is in our gut. So that's huge. You probably know that if you're not eating well, you're more prone to getting a virus, or you might be sick for longer, right? The gut sends and receives signals from the brain. I already talked about that. And then there's other things that happen when the gut is unhealthy. Your mood is affected. You might have more anxiety, or just an altered mood. So that very much is affected because there's certain microbes in your gut that are that affect the neurotransmitters in your brain. It influences hormones and blood sugar balance. So if we're not moving our stool, those hormones and all of those, the insulin and estrogen is going to hang out and get reabsorbed. Toxins are going to get reabsorbed. We want to use what we need, get rid of toxins, use the estrogen, and get rid of estrogen. Otherwise, it hangs out and recycles. Not a good thing. This is still me, right? Okay. This is just a list of symptoms of disrupted digestion. So, quick questions. Anything on there surprise anybody?
Anxiety surprises me.
And that's the gut-brain connection. And certain overgrowths can cause more brain irritation. Skin flares, that can be all related to your gut. Not just hormones. Brain fog. I'm sure we've all had that. And the rest are pretty self-explanatory. Okay.
So Charlene walked us beautifully through how important the gut is to our overall health and what happens when our gut isn't working well and the symptoms that we have. So what we wanted to do is kind of, do a broad approach of showing you what are common digestive patterns we see, but then start to help you understand what we're thinking about when someone is experiencing these symptoms, like bloating and gas. It often reflects incomplete breakdown of food or slowed movement. And that means that food is sitting longer. And when it sits for a long period of time, fermentation can happen. And that leads to pressure and gas. When people have constipation, obviously they have slowed movement, but stress signaling can play a role. And sometimes bile flow, whether it's sluggish or reduced, can also impact constipation, which a lot of people don't connect. So what happens when you're constipated? As Charlene said, waste doesn't move forward efficiently. I'm trying to figure out the clicker. Okay, got it. Right.
Somehow we ended.
Okay. So diarrhea, it's, obviously urgency, and that's when the digestive system is reacting quickly. It's overstimulated and inflamed oftentimes. And that's when food just it moves too quickly through the intestines and it's not fully processed. Reflux and heartburn, I think, is very often misunderstood. A lot of people think it's low stomach acid, but clinically we see more a lot of people think it's high stomach acid, but clinically we see low stomach acid. And what it reflects is delayed stomach emptying and eating patterns that disrupt the digestion, which we're going to talk about. So when food doesn't move forward smoothly, pressure can build in our stomach, and it can actually push up contents upward through the esophagus, and the acid is there, and that's when people can get that heartburn or burning sensation. Okay, so we can't have a talk about your stomach without talking about stool, right? I don't know if you guys recognize on your right is the Bristol stool chart. And stool is so important. We talk about it with anybody when we're trying to figure out digestion, and actually when we meet with any client and we're just starting to work with them, because it's such an important clinical marker. And I don't know, maybe some people, at least some people that we've worked with, don't even look at their stool or pay attention. But it really can tell us a lot about what's happening with digestion. For instance, how well is food moving through the system, right? If someone's constipated, they're going to be type 1 and type 2, where they're having, those little nuggets and it's harder to pass the stool. And sometimes what we find is that people are just so used to their pattern that they've been having, like if it is constipation, that they just think it's normal. They don't know that it's not normal. And by really looking at the chart together with them and understanding and being like, oh, you think it's normal, but it's really not. So that's why we ask the questions and we look at the pictures so that we can really understand what is happening for them. It can tell us whether food is being broken down and absorbed properly, like the color of the stool. So if you have yellow stools, that it means that you're having a problem with the bile flow. If your stool sinks or floats, can tell us a difference of your fat absorption. And it tells us how effectively the body is clearing waste, right? We keep talking about how important it is to be able to clear the waste from our body. When you have a baby, they poop all the time, right? They're great because they're clearing the waste. And, as we get older, sometimes we think just, every 3 days might be fine because that's just how you had that pattern. But we really want to try. So the typical healthy pattern that we're looking for is to have type 3 and 4 on the chart. And the important thing is this should happen daily and it should be easy and with no strain or no, hesitancy. But also you don't want to have this urgency. So that's where when we start, we always want to look at the stool. It's just such a helpful, useful information. Okay. If anything you remember from tonight, if one thing you're going to remember from tonight's conversation is that stress alters digestion. And it's really often sometimes not talked about or overlooked, but it has such a significant role on how our digestion does. And here's why. If you remember back from biology class, right? The fight or flight response, where when we're running from a burning building, our body releases adrenaline and cortisol, our stress hormone. And it's doing that to help our body get ready for running from a burning building. It's increasing our heart rate, blood pressure, all those things it needs to do. Well, it doesn't care if we're going to digest our food because we might be dead tomorrow. So it shuts down all other things to just focus on what it needs to do. The problem is many of us are living in that chronic stress mode and we don't have an off switch. We're going from one thing to the next thing. We might be multitasking, taking care of elderly patients or clients or parents, or working our careers, or, we're just doing so much. And especially in this modern world, we're just very overstimulated. And this is impacting our digestion. And it's why we see a lot more problems that are being created now in this day and age. What it does in our body is it reduces stomach acid. I'm going to talk a minute about stomach acid. And it lowers all the enzyme outputs. It slows motility and it decreases our blood flow to our gut. So we all know, when things don't have good blood flow, it's not going to work well. And I just want you to understand, if someone continues to struggle with digestive symptoms, sometimes this is the missing piece that's not really being addressed. And it can keep people stuck. So stomach acid. This is a really important piece of digestion that often gets misunderstood. And many people think that too much stomach acid is causing the problem. And even in the traditional medicine realm, a lot of it is, if you have reflux, it's always about you have too much stomach acid. And, we used to prescribe a lot of antacids and medicines that decrease stomach acid. But what's really important is stomach acid is critical for digestion. You need it to break down protein, and protein is like the building blocks to everything in our body and part of all the biochemical processes that our body needs to do. It also is very important for absorbing different nutrients, like your vitamin B12, your iron and your zinc and your magnesium. And it also plays a key role in maintaining this balance of our microbiome, which we're going to talk about in a minute. And it triggers, it's like the trigger for enzyme release. So when we're digesting and breaking down food, our body will release enzymes that carry out a lot of the different digestive, carbohydrates, fats, and proteins. So what affects stomach acid? Well, we just talked about it. Stress, probably one of the biggest things that can affect digestion. Medications we talked about that on purpose are decreasing stomach acid. Long-term, that can be a problem because we can see those nutrient deficiencies. But if anybody here or on Zoom is on a medicine to decrease stomach acid, do not stop your medicine. It needs to be a conversation, and it needs to be done thoughtfully with your practitioner. But I want you just to be aware that stomach acid is very important. And we also see a decrease as we get older, and we don't make as much stomach acid, which then we're not going to be digesting our food as much as well. So how we eat really shapes digestion, and it's one of the most overlooked influences on digestion. And Charlene already talked a little bit about it, but digestion actually begins before the first bite. And we don't even realize it, but that's when our nervous system is sending a signal to our gut to say, get ready for digestion. And it's going to cause our saliva to release, and it's going to cause our stomach acid to be ready and our enzymes to be ready to help with digestion. But it's one of the things that we oftentimes kind of skip. And maybe we see the food, but we're just so quick to move on to the next thing. We might be multitasking. We might be, on our computers. We're like really eating, but not even paying attention that we're eating something. We may not even realize, what it smells like. We might be standing up while we're eating and cooking meals. So I want to know, anybody in the room, is anybody a fast eater? I was notorious.
Everything. When you said slow down, I'm like, oh my God, it's a story.
Totally.
I just need to do everything.
Yeah.
That's part of my job.
Yeah. And that's, I was too. And so it's one of those things that we just don't understand. When we're eating fast, we're taking away that first part of digestion already, right? And we're already, so if we add one habit on and then another one and another one, it's just creating this downstream effect where we're just going to have problems with our digestion, and sometimes we just won't feel good.
I think your comment about lifestyle, and particularly at jobs, I think when I was in the clinical part of nursing, if we even got a break to eat.
And you ate, I'm a nurse, we ate standing up. And you'd go take something, and then you'd come back and eat. And we're going to talk about how bad that is.
How many times I did not go to the bathroom when I needed to. It's crazy.
Yeah. Curious about something. Sorry, I just wanted to see something. That's the next one. Okay. Yeah. Okay. Did I go to the next one? Sorry, I was trying to play with something. Okay. So another thing, I got something up here I can't get rid of. Oh, there you go. How did I clear that? Okay. Okay. So one of the most under-recognized parts of digestion, and you may or may not heard of this, is called the migrating motor complex. Kind of a big word, but we call it the gut's cleanup cycle. And many times, like in a gastroenterologist's office, typically, or your regular doctor may not talk about this, but it's really important part of digestion. And that is that between meals, our small intestine is having these wave-like contractions to move food through the small intestine and clear it out. And that's on purpose, because if that doesn't happen, food will stay there and the bacteria there just love to eat all that extra food and fodder. And that's where we can get a buildup of gas and it can create problems. But also, if we're having slow motility and that's not happening, then you can get, like, if it's sitting in the colon, you're going to get like constipation because it's going to absorb water. So what's important is that this only runs when we're not eating. So who's my snackers in the room? I used to be a big snacker, right? Anytime we put something in our mouth, we're going to stop that cycle. And so gum chewing is one of the other things that can affect it. So we need space. So digestion needs to work, but we also need to have rest. And that's sometimes one of the things we really forget about is that rest cycle. It also needs a calm nervous system. So we only digest when we're in that calm parasympathetic nervous system. So what disrupts this cycle? Well, we just talked about it, constant snacking. And so to avoid that, we want to have really good, healthy meals. So we're not hungry to need to snack between meals. Chronic stress, right? Everyone's learning that, right? We're going to walk out of here and we're going to understand how much stress plays a role. Poor or disrupted sleep. You might not think about that, but the reason that that happens, first of all, when you're tired, you're going to want to snack most often. You're going to, because you're tired and you're looking for that quick, energy burst, but it also can stimulate our stress response. So we're in that stress response because we haven't slept, and that's going to decrease our digestion. Blood sugar swings. So all of us have can be impacted by blood sugar swings. It's not just diabetics. And when that happens, and that can be depending on what we're eating for foods, if we're not having fats with our meal or proteins and we're just eating like naked carbs, we can have blood sugar swings. But what that does is it's causing stress on our body. So again, that then creates less digestion. And we often can see hormonal shifts like low thyroid function, high insulin, high or low cortisol that can all disrupt this cycle. So what happens when this cycle is disrupted? Well, we talked about it, but specifically, and Charlene alluded to this earlier, is this bloating that happens at the end of the day. So sometimes you'll wake up feeling really great, your stomach feels good, and then you start noticing you have a meal, you have a snack, maybe getting a little bit uncomfortable. You have your dinner, you have a little dessert, and then by the end of the day, you're so uncomfortable, you're unbuttoning your pants, and you're just like, why am I feel so miserable at the end of the day? And that's because that cycle was disrupted and that food stood there, and it's just starting to create that food fodder and that fermentation. But here's another thing that can be confusing for people. It can cause this delayed gas after you eat a meal. So it takes about an hour and a half for the food to get to your small intestine. So sometimes you will eat your meal and then an hour and a half later, you start feeling bloated and get this gas. And that's because it's delayed and it's sitting there and it's not moving along and you're getting that fermentation. And I meant to tell you, the other thing about that, the migrating motor complex, is it takes 90 to 120 minutes to complete, if everything is working well. But if somebody has slowed motility, let's say they're lacking serotonin, which serotonin we know is like that feel-good hormone, but it actually plays a very critical role in motility. So if you have low serotonin, if you had a traumatic brain injury, that can affect motility. If you've had surgeries, that can affect the gut and you might have some adhesion. So if you have any like low thyroid function, that can slow your motility. So it can take sometimes for those people up to 3 hours. And that will play a role when we're talking later about meal spacing and timing. So the other thing that you can see when clearance is reduced is constipation. I talked about that. If the stool is sitting there, in the colon, it's going to pull out water, and then you're going to get that type 1, type 2, like pellets and hard stool that's really uncomfortable to pass. And it also can make foods feel more problematic. So if you have something that is a little bit more fermented, and then it has that slow digestion and it's just sitting there, and then that bacteria is just loving all of that, but it's creating more and more gas. I keep screwing this up. There we go. Okay. So with the migrating motor complex, meal timing matters. So not just, digestion, but that rest period. So think about this, if you remember, to help you remember this. You're at a party and they're serving hors d'oeuvres, and maybe it's something you don't like. That would be even better. And you're going to say, no, I'm resting right now. Right? So just something to think about. But, and that's why we around holidays, right? We see people feel miserable because they're going to parties, they're eating and they're talking, right? And then they're sitting down for more food, and then they're having dessert. And so their motor migrating complex just has no time to work, and you can just feel bloated. So just remember that. So we need to have space between meals, and we're going to talk about and give you some advice on that to help support that movement. And so that late eating also can be an issue, because when you eat and you go to bed, and I'm sure we've all done it, of course we have, right? Life, happens, but your body just doesn't digest well if you eat and then go to sleep, because it's trying to sleep and do all the other things it's supposed to do, and it's just not going to digest well. All right, of course, we have to talk about the microbiome. How many people in this room have heard about the microbiome? Yeah. And it's interesting because, I don't know, 20 years ago, people didn't really talk about it that much, but now we hear about it all the time, and we're really learning about how important and influential the microbiome is. And so for any of you, whether you're on Zoom or not, it is the trillions of microbes that live in our gut. And it also affects digestion, not just in the immune system and the nervous system. But what isn't talked about enough, I think, is that it's greatly affected by so many other things. Diet, yes. Stress, again, that word. Medications, certain medications can affect it. Antibiotics, right, can affect it. And timing, the timing that we talked about. So what I really want you to understand is the microbiome, whether it's healthy or not, imbalanced or not, is really the reason it is that way is because of the environment it's living in. So when we are looking at, what imbalance, and I'm going to show you, a map that we do sometimes on people, we're always thinking not just like they might have this extra bacteria that's higher than the other one. We're thinking about why is that happening? Because you really need to look at the environment that is creating this gut that might be imbalanced. Because if you don't fix why it's happening, anything you do really isn't going to help. So when we talk about the microbiome, and when we talk about imbalance, the clinical term is dysbiosis. And what that just means is that there's a mismatch in the balance of the bacteria. And I don't like to use good or bad, but there are some bacteria that have more negative effects on our health than other bacteria. And these are the symptoms that can really show up, though. The gas that we talked about, the bloating, fatigue is extremely common. And sometimes people don't, relate fatigue to not having a healthy gut. And inflammation is also a very common one. And that's like where your joints are achy and you feel puffy and inflamed. You can see that when you have that imbalance in your gut. So gut barrier. and you may have heard this because it's talked a lot about a little bit more, but it really matters. And you have to think about, the job of this digestive tract is to really almost police what is coming into our bloodstream. And so it regulates what's passing into the bloodstream. And usually, in this diagram, you can see on the left, but, sometimes I use my hands when I'm talking with clients. It's usually you want to have tight junctions because then only the little small microbes of nutrients can get through there, right? And it's keeping all the toxins like the pesticides we might eat or anything else that is coming into the gut that is bad away from our bloodstream. What can happen is, again, the gut barrier can respond to stress, to certain medications like non-steroidals are really tough on our gut barrier, or inflammation, or that microbial imbalance. That can all affect that gut barrier. And then what happens is we get, gaps in that junction, like on the right side of your screen. And what that means is that things that normally wouldn't get into our bloodstream, like proteins from the food that we're eating, can get in there, or toxins or pesticides into our bloodstream. And our bloodstream is like, what is this? This is not supposed to be here. And it creates this immune response. What I just want you to remember more importantly is that this gut barrier is very sensitive if our digestion isn't working well, which kind of makes sense.
So probably what your naturopath is doing is you're strengthening that in preparation for your surgery.
Correct.
Which makes all the sense in the world, yeah.
So, last, and I know I've been talking a lot of concepts here, but I think they're very important. Liver and gallbladder, they play a key role in digestion, and sometimes they're kind of not really thought about in that respect, but together they help break down and move dietary fats. I think most of us will recognize that. But they also play a key role in regular bowel movements. So when someone is constipated, we start saying, well, is the bile sluggish? Is the liver not healthy? Charlene already talked about it, but this is super important, is that it clears hormones because our body needs to make hormones, use them, and then lose them. But it also gets rid of all the metabolic byproducts. So we need a healthy liver. Bile is antibacterial, so it actually helps with the microbiome balance. So when flow is sluggish, many people will notice the constipation that I talked about, the pale stools that I talked about, bloating after a rich meal, or you can feel heavy or backed up. And just going back to the piece that I talked about with stress and how that really impacts digestion, because we all know that now, right? We all remember that. But that's where digestion doesn't just start in the gut, right? It starts with our experience, the body's experience when we're sitting down to eat a meal is so key to having good optimal digestion.
Okay, again, we're going to talk about digestion. We have to talk about fiber because most people, if you have a digestive issue, someone might say, well, just eat more fiber. Try this. I take this, do this. And if you usually go in to a medical professional, they're going to say, well, how much fiber are you getting? So that's all well and good, but this is just a mention of more fiber or taking fiber isn't always the answer. There's a lot more to it. So fiber helps support stool movement and regularity. Again, bile flow and elimination, and it supports or feeds a healthy gut environment, that microbiome. But more isn't always better because too much of the wrong type can make symptoms worse. The preparation, variety, and timing, again, matter with this. And the biggest takeaway with fiber is do not increase your fiber unless you're increasing your hydration. I mean, you have to drink a lot when you're doing a fiber supplement. These are just some common fiber types. I just wanted to touch on this. I'm not going to get way into it. Psyllium, easy, buy at Hannaford. It regulates stool, helps lower cholesterol, and it helps balance blood sugar. Oats, beta-glucans, our heart and metabolic health. Prebiotic fibers, again, are the things that support the microbiome and feed the microbiome. Cellulose is going to stool bulk and increase regularity, help with motility. And then the PHGG is a lot of times used for really inflamed guts. Maybe people that have alternate with constipation and diarrhea, or just have diarrhea, or just have constipation. So it's a more gentle support for that. So how we evaluate digestive symptoms. Again, we have a client comes in with a symptom. We're going to look at the digestive breakdown. Then we are going to think about the digestive movement and timing, the stress on the nervous system. You guys are going to be able to recite this by the time we're done. The health of the microbiome and the liver clearance and bile function. So there's a lot more to think about than just, what's going on here. It's a lot of other things. And IBS. Has anyone heard that term? Yes, irritable bowel syndrome. It's a very common term. It's used often. It describes a collection of symptoms. Again, it's really about the symptoms that just don't fit perfectly into that little box.
Kind of a garbage can to put in.
It has been called a garbage can diagnosis. Yes, didn't want to say that, but thank you. Feel like I can say that now. It really has, and what we find. It doesn't explain why your symptoms are happening, and this is kind of what we do. It's like, why are you bloated? Oh, it's because I have IBS. Well, nope. Try again. Or why can't I poop every day? It's because I have IBS. And people just accept that and just move on. Like, this is just who I am and this is what I have. So what's often overlooked is digestion and the timing and the regulation and all of the things we've been talking about. So I just wanted to put that in there because it is just so common, and you don't have to, that doesn't have to be your normal. Let's just leave it there. So common things that we see when people come to us is they have ongoing symptoms. They're either just constantly bloating, or they just can't regulate their bowels. They can't go out to eat because they always have to have a bathroom very quickly. Whatever the case is. They also come to us when there's no clear explanation of what's going on. They keep going back and they're just, well, you just have IBS, or you just have whatever the case is. They're just not getting explanations of what's going on and getting sick of it. They have digestive irregularity, which I mentioned, and the stress hasn't been addressed with people, which isn't really addressed in conventional medicine much. I think maybe I've been asked if I'm stressed, but who isn't? I mean, there's just more that needs to be discussed. So those are just some common patterns that we see. And now Deb's going to talk about a client story and put everything together.
Yeah, so just to kind of help frame everything that we were just talking about, this is a client that came to us who was a 59-year-old woman who was completely exhausted, achy, bloated every day, occasionally constipated, and having these irregular stools. And she was really frustrated because nothing was improving. And she just said, I shouldn't feel this terrible and this old and not being able to play with her grandchildren. And what was interesting is she had some nutrient deficiencies were present on her lab. She had low iron and low B12, and she already had a normal colonoscopy. So they just said, you have low iron, and put her on iron. And she was not menstruating anymore. So when we start looking at her picture, this is sort of just the framework, which I think Charlene and I have talked about tonight, is we kind of look at this pattern and we say, okay, what's going on? What do we think her microbiome balance looks like? And certainly she wasn't digesting well because her B12 and her iron were low. So something was happening in her digestion. she had the inflammatory signals, that achiness and joint pain that she had, that was all over. It wasn't just like, hip arthritis, and kind of felt inflamed. And she had the fatigue that we often see when sometimes there's immune reactivity or even just the inflammatory signals. And so this is sort of the context, like we were always saying, is you have to look beyond just what's happening in the gut and look at the whole person to say, why is this happening? And what can we find? So sometimes when we're working with people, we do a functional medicine stool test. I don't know if you've heard of the GI map, is one we use. Sometimes we use GI effects. It depends what the purpose of the test is. And this is just what it can look like. And for her, you can see, like, if you don't have to know how to look at this. That's our job to interpret this, but it just gives us a snapshot, a deeper snapshot into digestion. And so she had a H. pylori overgrowth. There was somebody on Zoom who has unfortunately had a reoccurrence of that. And when you have H. pylori, which is a bacteria that can be asymptomatic, and 50% of the population can have it, and it doesn't create problems. But it can decrease stomach acid, and you can then not have that digestion that's happening, the B12 and the iron. But in the middle section is kind of just where the different, and there's, trillions of microbes, and this is just specific ones that have been researched and studied and shown to have certain effects on digestion. And that just gives us a snapshot of what's happening for her. But then we can go on the right, it is your right side, on your right side, the steatocrit and elastase, that's just telling us how we're digesting our fats and our proteins. And you can see that that was affected. Again, we're looking at the whole picture, right? This pattern that we're seeing is that her digestion is being affected. And then in the middle part, lower section of that, you're seeing, like, if she has blood, which she didn't, but what her immune system, secretory IgA is our immune system in our gut, and hers was not healthy. And she also had some calprotectin. So there was inflammation. Calprotectin is a marker of inflammation. And so this fit how she felt, right? And we knew, like, she wasn't digesting. And so, we did different things and treated her gut in various ways to deal with some of her overgrowth. But we addressed everything, like her stress, because she had a lot of stress at work. She was a fast eater. And we had to deal with that component as well as all the other things that we were talking about. She had the occasional constipation. She wasn't moving well. She was snacking. She was a big snacker, right? So she's slowing down that migrating motor complex. And we did address for her, because of her digestion showing that it wasn't well, her H. pylori. And so it's just an example of how we sort of handle things when we're looking at digestion. And if, actually, I'll let Charlene talk about the key takeaway points.
Okay, we're almost there. You guys are doing great. So, key take-home points. Stress. Did anyone hear us talk about that? Stress matters very much with digestion. Movement is key. Meal timing matters. Stomach acid is important. And digestion is a full body experience. And that's the way we look at any digestive symptoms that are altered. So, what can you do tonight? Go home. I'm not going to give you any supplements. I'm not going to treat you with anything else. These are just lifestyle changes you can do. The first and easiest thing you can do is prepare your body for digestion. So I don't know how you typically do your meals, but when you fill your plate, I want you to actually sit in a chair and take a minute. Don't grab your fork, but just take a minute and do a couple of breaths and just prepare. Your brain is connecting to your gut and everything is preparing. Just know that that is happening in that moment. Be very present at your meal, not near your phone or your laptop or the TV. Just sit and be present. And again, sitting down preferably. So also respect timing. So between meals, allow 3 to 4 hours. Avoid the snacking and let that rest time that Deb talked about, that's so important, let that happen. And try to eat 3 hours before you go to bed. I mean, once in a while, you're going to have a late meal out, whatever you do. I know when I go out, I'm always the one that's like, well, can we go at like 5:30? But I don't always win. So those are tough nights. I hate eating before bed. I hate it. And I'm an early to bed kind of gal. So that's important too. Support the breakdown, meaning slow down again and chew your food. Help your body do what it needs to do. You can do a lot right here. This is what this is for. Chew and chew and chew and chew. Not twice and down the gullet. You got to chew. So think about that. I want to challenge you yourselves when you go home to try and chew 25 times. It's a lot. It's not easy to do. And the other thing, when I was learning all of this, when we were doing our training, another thing that helped me to start all of this slowing down and being more present is I would put my fork down between bites. Imagine. Like, it's hard. But the more you do that, the more you're just going to be present in the meal. And again, avoid multitasking while you're eating. Goes without saying right there. Support hydration. So hydrate really well. And the key word here is between meals. Do not sit down and think you're going to catch up with your hydration at your meal. Nope, don't do that. Do not drink large amounts of water during a meal. The actual amount you should be drinking during a meal is only 4 ounces. It's tiny, tiny.
Why is that?
Because if you think about the food in your stomach and then 16 ounces of water, you're diluting all of the acid and enzymes that are supposed to be breaking down all those nutrients. So it's not able to break down as well. And that is something I did not learn until I learned about functional medicine. Never knew that. I was always drinking at my meals. So, and the other big one is encouraging movement. Gentle movement or walking after meals is a great way to aid in digestion. It's huge. It also helps with blood sugar regulation. So that's a win-win. You got to move to move. Like that?
Yes.
I just came up with that when we were practicing. So small shifts in lifestyle habits can change how the whole GI system behaves, which I just discussed. Now, that's not giving you any pills, not taking any enzymes. Those are just basic things that I think if you move forward and incorporate them, you might see some better digestion. Hopefully, that is the whole plan. So if you want to continue this conversation, we've got some QR codes to do a free consult with either one of us. We also have a Facebook group where we talk about all things functional medicine, not just digestion. So thank you. That's it.
Thank you.